YouTube. Thank you again for your support. This is Dr. Margolin, Opioid Education Channel. First of all, I again want to help everybody who helped us and supported us, and we are in less than 2 weeks, 300 subscribers strong, and we means the word to us. Thank you for all your support. We got a question from one of the subscribers. I think it's a good question. Tell us about OxyContin. What's the story of OxyContin? How is it connected to opioid epidemic? What can I do if I or somebody in my family is on Oxycodone? If I'm on Percocet, is it still dangerous? Is it related to OxyContin? Tell us more. Why it was so devastating, and what can we do to stay safe? Great question. OxyContin, contin stands for continuous. OxyContin is actually a long-acting preparation of something called oxycodone. Oxycodone is the chemical, is the pain reliever, which is in this medication. It's something we call semi-synthetic opioid. What does it mean? Opioid is something that you can extract from opioid plant, and if you modify it, it's called synthetic. So it's semi-synthetic. It's a combination of something synthesized and obtained from opioid plant. This is the formula. No means you don't need to memorize it, but this is the general idea. Now, oxycodone is short-acting medication. Short-acting means it works for 4 hours. It means you administer the medication, the level goes up, and then the level goes down. In the past, people were concerned about this level changed, and they tried to keep levels steady, and that's why it's hard to see, but it says every 12 hours and different doses, 10, 15, 20, 30, 40, 60, and 80 milligrams. They thought they would create a medication. There's again different formulation of OxyContin that would keep the levels steady for 12 hours. And in the past 15 years ago, even a little bit before that, they thought that it would be safer and better medication for patients. They created something called delivery system with polymer coating, different drug layers that basically was supposed to ensure slow, continuous release of medication into the bloodstream. That's what OxyContin is. Now, why it has such a big name? What actually happened? What actually happened is that the delivery system initially did not function well, and it delivered the medication over a few hours, not over 12 hours the way it was marketed, and it was marketed to doctors this way. It was actually delivered very fast. It was a very potent medication, 1.5 times stronger than morphine, delivered very fast, caused this surge, this feeling of high, and susceptible patients developed tolerance and then addiction to this medication. Initially, the substance was also not what we call abuse deterrent. You were able to take the capsule, abuse it. It got very high street value, and it actually caused a lot of devastation and suffering in some areas, and I think it's being looked at even now. At some point, people realized that the capsule is not safe, and they basically changed the capsule. It happened already quite a few years ago, and new OxyContin capsule is safe. It's safe, and it provides delivery really over 12 hours. They fixed the problem after quite a few years and a lot of casualties. In addition, they developed something called abuse deterrent version of continuous oxycodone called Xtampza. Xtampza is very similar to OxyContin in terms of the basic assumption, basic principle, but is abuse deterrent. It's hard to abuse, and it's really being released slowly into the bloodstream. So this is the background information. Now, answering the question, how safe is OxyContin now? I would say it's fairly safe. I would say Xtampza is a better version of OxyContin. However, there is a general question, do you really need OxyContin? You need to make sure you get OxyContin on any narcotic medication only when you really need it. That's why you need to see a reputable professional, preferably board certified and fellowship trained in pain management, who can assess you It's still a problem when, in many cases, they're excellent primary cares and they're excellent independent nurse practitioners, but many times if they prescribe this medication without supervision of pain management, if they started in the hospitals after surgery and then continued for a very long time, it can create problems. We're going to address it in our next video, what you should expect and what setup is optimal for narcotic medication. There is also a debate now whether short-acting medication or long-acting medication is safer. In other words, is it safer to give short-acting medication despite the levels going up and down? It's still safer because it goes out of your system in 4 hours, and OxyContin or some other medication can stay a very long time. So if there is a problem, for example, it suppresses your respiration, it's very hard to take out of your system. So it's a complex decision. You need to consider risks and benefits. You need to see what delivery system is short-acting or long-acting is better for you. And you need to make sure there is appropriate monitoring. And we got this question about what appropriate monitoring is. We'll address it in the next video. I hope we answered the question. If you like this video, please subscribe, please press the like button. And again, thank you again for your support. I would like to thank CPMI team for making this channel possible. Thank you.
Hello, I'm William Gibson. I'm a veteran. I came to Dr. Margolin 3 years ago. I'd been suffering from pain for over 20 years, severe pain. And my regular doctor had me on Oxycodone, which only brought me down to about a 3 pain level. After being interviewed by Dr. Margolin, he put me on a whole new pain regimen, and I experienced complete relief of pain for the first time in over 20 years. I would highly recommend that you see him. He'll do a wonderful job for you.